Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about some of the criteria that we use in ultrasound to determine whether or not a pregnancy is a fetal demise. Now, there are 6 criteria that we basically go off of, as in 6 different scenarios that we can use to classify whether or not a pregnancy is actually going to end in a failure or has already ended in a demise. And the first 2 that I'm going to talk about are basically scenarios that will be determined at the first scan that you get in pregnancy. And then the next 4 after that are going to be determined at the follow up scans that you get. Now, it is important to note that these are all criteria that are going to be based mostly in the first trimester, except for the very last one. But essentially, you can think about all of these criteria as being applicable in the first trimester, with the last one being applicable at any point in the pregnancy. So the first scenario that I'm going to talk about is if there is a embryo seen or a fetal pole and it is greater than 7 millimeters. So essentially greater than 6 weeks, 6 days. That's about how big 7 millimeters translates into with gestational age. So essentially, if there is a fetal pole that is bigger than 6 weeks, 6 days, but there is still no fetal heart rate seen, then we are going to call this a fetal demise because we do detect the fetal heart rate at about 5 weeks, 5 days in ultrasound. And there is a bit of wiggle room in that, but that's kind of the earliest that we can detect a fetal heart rate. But if baby is at the 6 weeks, 6 days mark or over, and there is still no cardiac activity, then we are unfortunately going to have to call that a fetal demise. The second scenario is going to be if the mean sac diameter, which is in relation to the gestational sac, so essentially where baby lives, kind of that big black area where you're going to see the yolk sac and the embryo. So if that measurement, which we measure it in 3 planes to get a mean sac diameter, or in other words, just an average measurement of it, if we see that and it is measuring more than 25 millimeters, which translates to about 8 weeks or so along in pregnancy, but we don't see anything else in it, as in no embryo and no yolk sac, that is also classified as a pregnancy failure. We call this a blighted ovum, and essentially this means that there is a gestational sac, so a home for where the baby is supposed to be, but either the baby did not develop or it developed and then ended up not making it pretty early on and got reabsorbed by the body, so therefore there's only the empty sac left. Now, as I stated in the beginning part of the video, the next 4 scenarios are going to be more determined at your follow-up scans versus the 2 that I just talked about are going to be determined on your first scan if those 2 criteria were seen. The third scenario is going to be if we see only a gestational sac present at your first ultrasound, but then at your follow-up in 14 days' time, there is still no embryo with a fetal heart rate. So, to describe the scenario to you a little bit better, you can think of us being able to see the gestational sac about 5 weeks, 0 days along in your pregnancy. If this is all we see at your first scan, what we're going to do is book a follow up for 14 days' time, just so it gives us enough time to definitively say whether or not the pregnancy is successful or it is a loss. As in, we don't want to book it, a couple days from that first scan because at that point it still may be too early to see anything, which is why we wait the full 14 days before we book a follow up. So again, at gestational sac being 5 weeks, 0 days or so is going to be the earliest that we can see it. And hypothetically, if we saw it at 5 weeks, 0 days, and then we go ahead and follow up in 2 weeks, it should be 7 weeks, 0 days. And at that point, if there's nothing seen in there, then again, it is a blighted ovum and we can call it unfortunately, a pregnancy failure. And for the next scenario, this is when we can see a gestational sac and a yolk sac present at your first scan. And by the way, the yolk sac is going to be the nutrient sac for baby before your placenta develops. But if we see those 2 things, so the gestational sac and the yolk sac at the first scan, but there is no embryo seen, we are going to do a follow up in 11 days' time. And if at that point, at that follow up, there is still no fetal pole seen with a fetal heart rate, then that is again a pregnancy loss or a pregnancy failure. This is because when we kind of use that logic that I just described to you, when we see a gestational sac only to this scenario, when we see a gestational sac and a yolk sac, then the pregnancy is going to be about 5 weeks, 1 day to about 5 weeks, 3 days when there is both the gestational sac seen, but not the embryo, but there's still a yolk sac. So again, if we wait kind of that 11-day time frame, we should be at around 7 weeks, and there absolutely should be a fetal pulse seen with a fetal heart rate at that point. And if there isn't, then we can definitively call it as a pregnancy loss. The next scenario is going to be if we see a fetal pole that is less than 7 millimeters. So again, less than 6 weeks, 6 days at your first scan with no fetal heart rate. But then at the follow-up scan that we schedule in about 7 days' time, there is still no cardiac activity detected. This is because, so again, we can see the fetal heart at about 5 weeks, 5 days detected on ultrasound, but we want to give kind of that leeway of up to about 6 weeks, 6 days before we call it for sure a demise. But let's just say baby is around 6 weeks along at that first scan, and we still don't see any sort of cardiac activity. We still err on the side of saying, okay, well, maybe it is still too early, or maybe it is just slow to actually appear. Maybe we're not seeing it yet, etc. But then if we wait a week from then and it is still not there, so that brings us to about 7 weeks, then we are going to call it a pregnancy failure because, again, at that point in about a week's time, then there absolutely should be fetal heart rate detected. And if not, then we know that it is a pregnancy failure. And the last scenario is applicable for the first trimester, second trimester, as well as the third trimester. And this is where we have seen fetal cardiac activity at the scan that was previous to the one that you're having, but now we are not seeing it today. So hopefully that is pretty self-explanatory, as in at the scan that you had before this, you saw a fetal heart rate and baby was doing well, or at least had a fetal heart rate. But now at this scan that you have today, unfortunately, we do not see any sort of cardiac activity. So that is definitely going to be a sign to us that the heart stopped at some point between the last scan and the one that you are having today. And then we can also call that a miscarriage or a fetal loss at that point. Now, I know that pregnancy loss is super common and it is very difficult and almost taboo to talk about, but I do think that it needs to be talked about more and even just talked about in the way of having more of an awareness around it, which is why I made this video, and hopefully it did help you guys kind of understand more of the criteria that we use when we are determining whether or not a pregnancy is a pregnancy loss, and basically how we came to that conclusion in the end. And like usual, if you guys have found this video helpful, please go ahead and like and subscribe and comment, and also check me out on TikTok. I make videos over there as well.